Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today, we are talking about something many people hear about, but many still do not really understand: health screening. What is it? Which tests are simple? Which are more invasive? When should we start? How often? What about family history? And do we need fasting or not? Let's make it clear, calm, and simple.
Yes, when we understand screening properly, it feels less scary and more like normal care for our future health. Let's go step by step.
So first, doctor, what is health screening in easy words?
Health screening means checking for certain diseases or risk factors before you feel sick. You may feel normal, but we check for things like high blood pressure, high blood sugar, high cholesterol, and some cancers that can start quietly. The goal is to find problems early, when treatment is easier and results are better. Screening is different from tests we do when you already have strong symptoms.
People also hear non-invasive and invasive tests. Can you explain the difference?
Of course, non-invasive tests do not go deep inside your body. These include checking blood pressure, weight, waist size, basic eye checks, urine tests, many blood tests, an ECG, ultrasound, and mammograms. They are usually simple and low risk. Invasive tests go inside the body or use a needle or instrument. Examples are a pap test of the cervix, colonoscopy to look inside the large intestine, endoscopy to look at the stomach, or a biopsy, where we take a small sample of tissue. These tests are very useful, but they are done when your age, history, or symptoms show that they are needed, not for everyone all the time.
So, when should a healthy person start thinking about screening?
We start with small things early, then add more with age. In your 20s, it is good to know your blood pressure, weight, and basic lifestyle risks. If you have extra weight, family history of early heart disease or diabetes, your doctor may also check your sugar or cholesterol. In your 30s, you continue with regular checks. Women should follow cervical screening advice based on their country's guidelines. From around 40, screening becomes more important. We pay close attention to blood pressure, sugar, cholesterol, and start recommended cancer screening like breast, cervical, or colon, depending on age, sex, and national guidelines. After 60, we continue or adjust screening based on your overall health and life expectancy. The exact plan can be slightly different between countries, but the idea is the same. Do not wait for a big problem before you check.
So, it is not only for old people.
Exactly. High blood pressure, high sugar, high cholesterol, and some cancers can start earlier than people think. Screening is about the right test, at the right time, for the right person.
How does family history change this?
Family history is very important. If a close family member had a heart attack or stroke at a young age, or has diabetes, very high cholesterol, breast cancer, colon cancer, or certain other cancers, your own risk can be higher. In that case, your doctor may start some tests earlier and repeat them more often. For example, colon or breast screening may start younger than for the general population. So always tell your doctor about your parents, brothers, sisters, and children. Good information from you helps us build the right plan and may save your life.
People also ask a very practical question: how often should I go for screening?
Think regular and guided, not once in a lifetime, and not every week. Most healthy adults should have a general check with a doctor about once a year or once every 2 years if they are low risk and stable. At that visit, your doctor decides which tests you need based on your age, family history, previous results, and risk factors. Blood pressure is checked often, even at home. Blood sugar and cholesterol might be checked every 1 to 3 or 5 years if normal, more often if high, or if you have risks. Cancer screening has its own timing, such as every few years for cervical screening, regular mammograms in certain age ranges, and colon screening at set intervals. If any result is abnormal, testing becomes more frequent and more specific. So there is no single schedule for everyone. The key is to stay linked with one clinic that knows your story.
Before going for screening, people worry about preparation. Do I need to fast? How long? Can I drink water? What about alcohol, heavy food, and my daily medicines?
These are good questions. The most important rule is follow the instructions from your own clinic because different tests have different needs. But we can give a clear overview. For many routine checks, you do not need to fast. General checkups, blood pressure, weight, waist size, basic eye checks, urine test, many blood tests, and ECG, ultrasound, and mammograms can be done after eating. Some tests work better with fasting, such as fasting blood sugar and some full cholesterol panels. If fasting is needed, your doctor or nurse will tell you clearly. Fasting usually means no food for about 8 to 12 hours before the test. You can drink plain water, and water is actually helpful. Avoid alcohol the day before, and try not to eat a very heavy, very fatty meal the night before important blood tests, because it can change some results. About medicines, in most cases, you should continue your regular medicines, especially for blood pressure and heart, unless your doctor gives other advice. For people with diabetes, sometimes we adjust or delay certain medicines or insulin on a fasting morning. This should always be checked with your own doctor or nurse before the test. So do not stop important medicines by yourself. Ask first.
So, simple message: follow the instructions, drink water, avoid alcohol and very fatty food before key blood tests, and never change medicines without advice.
Exactly. That keeps your results accurate and keeps you safe.
Now, what should people do to make screening really useful?
Choose a trusted clinic or hospital. Tell the truth about your lifestyle, family history, and medicines. Bring old reports if you have them, so your doctor can compare. Listen to the explanation of each test and ask if you don't understand. Screening works best when there is trust and clear communication.
And what should they avoid?
Do not buy big test packages just because of advertising without asking a doctor if they are right for you. Do not ignore abnormal results. If the report is not normal, go back and talk about the next step. Do not believe that more tests always mean better care. Some invasive tests have risks and should be used only when they are needed. Do not let a normal test make you careless. You still need healthy food, movement, good sleep, and no smoking. And do not wait for strong warning signs like chest pain, blood in the stool, sudden weight loss, or severe headache before seeing a doctor. Screening is meant to come before these serious symptoms.
That makes sense. So, doctor, if we put everything into one clear message.
Health screening is like regular care for your body, not punishment and not fear. It helps find silent problems early, supports better choices, and gives you a plan that fits your age, your family history, and your health risks. The best plan is personal, made with a trusted doctor based on real medical guidelines, not social media trends.
Thank you, doctor. And to everyone watching, this video is for education only. It does not replace a visit with your own doctor or local clinic. Please ask your doctor which screening tests are right for you in your country, at your age, and with your family history. Thank you for watching Dr. Health Hub. Your health is your wealth. Stay tuned for the next doctor tip you can trust.